everyone experiences this and no one understands it. And it's kind of ridiculous because we could.
FACS is the most inclusive group that I've ever heard of that teaches about this kind of planning.
It's critical that medical students are aware and knowledgeable of modern fertility awareness-based methods. FACS is the first step. We are laying the foundation to ensure that the next generation of medical professionals are fully aware and understand the importance of fertility awareness-based methods to provide true, comprehensive women's health care.
Women are really hungry for this information. I can't tell you how many times I've had women sit in my practice and tell me that they were dismissed by their medical provider when they were told they wanted to go off the birth control pill.
If we had a headache, yeah, we might treat it with Tylenol, but if it keeps coming back, you want to understand why you're having the headache. There are some things that are extremely life-threatening that can be a headache, and you don't just want to keep throwing Tylenol at it. Well, it's the same thing with the women's reproductive system. There can be some really significant underlying causes for the symptoms that we're experiencing, and if you just throw the pill at it, then you're not making your diagnosis and you're not treating it.
This really teaches normal anatomy and physiology better than I ever learned it in the first place.
Currently, most healthcare professionals don't get this as a part of their core curriculum, and they really should.
There are so many people wanting this kind of care and not enough providers.
Every time that I've seen a provider who is offering fertility awareness-based methods to their patients, it's self-generating demand.
I mean, there are many reasons why women would want to discontinue the pill that have nothing to do with wanting to conceive. And I think it's just sad that there's not enough practitioners, whether you're an MD, a DO, an ND, encouraging women to explore the management of their fertility in other ways. It's unfair, and I think that we need to work on that. We have to do better because women deserve better.
This course will offer an incredible opportunity for you to understand the important role for adolescents to chart their fertility, to understand their cycle, to know when they're going to get their next period, to have a better idea of what's happening in their bodies. This course is going to introduce you to a way to address common women's reproductive health issues like endometriosis and polycystic ovarian syndrome, conditions that are often only temporarily treated through suppression with hormonal contraception. This course is going to provide an introduction to using fertility awareness-based methods to more effectively facilitate the diagnosis and treatment of these conditions.
For me, it wasn't until I went through and became a medical consultant for the Creighton Model of Natural Family Planning, it wasn't until then that I really understood the menstrual cycle. And I'm like, now I get it, now I understand it. Your body is going to tell us what's going on with you, and between the two of us, we're going to figure out what's going on with your menstrual cycles.
The question about whether these methods are valid or not, if there's medical evidence supporting them, that shouldn't be a question anymore, thanks to Dr. Duane and FACS.
We are so excited that you are here because this will be a wonderful opportunity for you to expand your understanding of women's health in ways in which women can better learn to monitor and manage their health.
Without FABMs, I feel patients are not getting the full reproductive care that they deserve.
Finally, the spotlight is being put on this, which I think is really powerful for any medical student because you have the ability to do additional training and then forever probably change the way that you work with women.
Take a look at the science, take a look at the outcomes, and figure out how to integrate this into your medical school curriculums.
This is the future of women's healthcare, so get on board.